So I'm moderating a session tomorrow, a fairly important session, I think, about whether HER2-low breast cancer is a separate entity with a separate biological characteristics and clinical characteristics. And we're having a debate from, number one, we're going to talk about the pathology. David Rim, who is a well-known pathologist, is going to talk about just the pathology of detecting HER2 and potentially some of the newer technologies for finding out whether someone is HER2-low or not. HER2-low is important because it is an indication to use an antibody-drug conjugate, Trastuzumab deruxtecan. So clearly it's a great biomarker potentially for response. And so he'll talk about that. Then we're going to have a debate. Sarah Tolani from Dana-Farber and Giuseppe Coligliano from Italy are going to take the pro and the con side about whether this HER2-low entity is truly biologically distinct. And I think the conclusions will likely be that it is not. That it's, we have, I think, 15 or 16 abstracts around the special session that really speak to this. And I think the sum total, at least in my experience, is that HER2-low is unlikely to be a separate entity. However, that does not diminish the utility of this as a biomarker for response for a very active drug, Trastuzumab deruxtecan.